to the right, and we'll answer those as well. But this is all not about Healthy Roster. This is all about resources and answering questions. So if you have questions, put them there, but this is not about Healthy Roster. Our demo for Healthy Roster will be tomorrow at 1:30. So today is about resources and helping. Then tomorrow is the webinar. And then Wednesday, again, we'll have another session that will probably add some questions or do the same one we're doing here with Daniel. So with that, I will get started. Now, let me say this. At Healthy Roster, when the crisis happened, when COVID happened, we said, what can we do to help PTs? The first step was we didn't want to make price an issue. So until July 1st, we made it free. Then we worked with a lot of PTs, large groups, small groups, and we're helping everyone move to telehealth. And in that process, I was a part of a lot of Facebook groups. Some of the groups, 20,000 people, you name it. And in there, when people ask questions, other people would respond back saying, you should ask Daniel. You should go ask Daniel. Daniel's a great resource. So I myself said, I got to reach out to Daniel. So we have here today, we're proud to have Daniel Seidler. Daniel, why don't you tell us a little about yourself?
Thank you, Michael. First off, I'm a physical therapist. I was a practice owner for 15 years, and then I worked with a larger group for a few years. And in that time, around beginning of end of 2018, we started looking into telehealth. We thought it would be a good option for cancellations and no-shows, a good way to grow the practice, maybe doing some triage and some intakes. And we grew it from there. I did a lot of research on some platforms, policy and procedures, all the legal side of it, and I put together a program for that group. We grew it. They had 80 locations. We had people all over the East Coast doing a few telehealth visits. It really wasn't a huge part of the practice at the time, but it's grown gradually over the past few years. And I left there about 9 months ago with the telehealth program in place, handed it off to another manager, and they continued to grow the practice, and they were very prepared for the COVID moment. I also, in that time, I started growing my own practice in doing consulting to PT practices that wanted to do similar things. They wanted to grow their practice, cover for cancellations, no-shows, and have opportunities in telehealth. And we explored a lot of things. So I discovered a lot of things in the past 9 months. And then a tidal wave of interest in telehealth came. And, it's amazing. I always knew that telehealth would have a place in PT and in medicine. And, I still think this is just the beginning in a very big way. I never assumed that it would come at me so fast, or that the whole industry would grow so fast. 6 months ago, my mother didn't know what the word telehealth meant. Most people didn't. I had to explain it to people every time I brought it up. So that's been my life for the past 6 months at least.
Yeah, and I think everybody can relate to that. Same with my mom. She was saying, I got some email or link, and I gotta connect, and I'm supposed to get my knee drained, and I guess I'm doing a visit virtually first. It was kind of funny. But yeah, it's great. So what I want to do is, again, everybody, feel free to ask your questions. You can chat them to us. Clark, maybe monitor Facebook. I'm not looking at Facebook, but the questions that come in there, kind of post them to me. And then as well, I'm going to go through a list. I'm not Howard Stern. I'm not the world's best interviewer here. So I'll just be going through a list of questions that we kind of prepped that we thought would be best for everyone. So as I say that, let's get started. So
you're a good conversationalist, Michael, so this should be easy.
So, a lot of people, when they first came out, they're like, oh, you can do this with Google Hangout, or you could do this with FaceTime. So what do you feel about the HIPAA compliance portion of doing telehealth?
Well, I think, in the first 2 weeks of the COVID emergency, people were really scrambling and didn't know the first thing about telehealth. At this stage of the game, everybody should be looking at telehealth and remote care as a part of their practice for the short term and the long term. I'll talk about it more after, but I think that remote care is going to be a big part of all healthcare going forward, and a growing part. So my idea, or my belief, is that you absolutely should be doing it the right way now. You should be HIPAA compliant. that sort of HIPAA compliance is not being enforced right now, but you should be putting a telehealth program in place, and you should be doing things the right way. Because if you don't, you're gonna have to fix it down the road. So
that's what I was thinking too. I said, all right, so now you're doing FaceTime, or you're doing, so first of all, you're doing FaceTime, and what device are they on and all that, or you're doing a Google Hangout. Now they all get comfortable. Your patients get comfortable with that, and
That's
now
right.
all of a sudden the insurance companies go, no, you got to be HIPAA compliant, and now you got to teach them in a whole new way. Yeah, that's
it's only a matter of time. And look, digital security is a growing concern. Anyone who has an EMR or does any sort of digital transferring of documents knows that. So you should get HIPAA compliant now. Get a BAA with your platform vendor and do it the right way the first time, so that you don't have to do it again.
So, one thing else, I talk to physical therapists all the time, and right now I feel like we're doing a lot more educating than normal, because there's so many people saying, we do telehealth. Companies that I know that never touched the idea of a video chat with someone ever before. We've been doing it for years, and all of a sudden in 1 week they got, we do telehealth. So what is like the most important features or aspects of telehealth they should be looking for?
Well, first and foremost, you should be looking at security. Beyond that, ease of use and reliability. The patient and the provider need to be able to get into a session with no friction, right? It should be very easy to schedule a patient, for them to get onto that visit, and not have to scramble and download lots of widgets and apps and all other. It should be as easy as possible. And once on, it needs to be reliable. It needs to be a reliable platform that's not going to drop in the middle of the session. You're not going to get blips. You're not going to get delays, buffering, things like that. So ease of use. Otherwise, you can have
a salesperson that's done remote demos forever. I can recall back in the day, systems got a little better, where your first 10 minutes of a call was saying, all right, you need to click here. Now you're going to download this, accept this. You can't do that on a visit. They're going to be like, you know what, forget it. It's got to be one click and I'm in.
If you went to a car dealership and you're going for a test drive, you go to turn the car on and it doesn't turn on, or you can't figure out where the ignition is.
You're not buying the car.
You're going to be like, you're not buying that car.
Yeah, exactly. So it's got to be the same.
Make it easy.
One click and in. Make it easy.
Perfect. It easy. Definitely.
What about legal considerations? Documentation of like before visit or anything else? Any legal considerations they should be aware of?
Yeah, and anything legal is related to the states. It's state by state, but for the most part, you do need to have patient consent, whether it's verbal or written. So my recommendation, best practice, is to get written consent at the beginning of your term of telehealth with a patient. So before your first telehealth visit, make sure you get written consent. And a lot of the platforms do that. You can either give them your consent form that you want to use, or they have a consent form that's applicable to PT or your profession. Yep. And the patient will be either forced to do it, or it's just part of what they do before a session.
Make it, and then that's another step of making it easy for them. I know some people are doing it sitting on a call, but also making it really easy. That's great. What about again, one of the things I hear is these patients, this is so new to them, that how do you get the patient comfortable with the idea of doing a telehealth visit?
Yeah, there's a lot of strategies for that, I think, and it really depends on the patient. Younger patients tend to be more comfortable with the technology. Older patients might be a little bit more intimidated by it. May even say, plenty of patients say, I don't even have a computer, but most people have a smartphone, or somebody in their life who has a smartphone or a laptop or an iPad, and it's very important that you make them comfortable with the technology first. So my recommendation to practices is to do test runs or do webinars with patients who've never done it before. So you do like on a Thursday afternoon at 4:00, you do a webinar to show patients how easy it's going to be for them to log on, maybe a video of an example of a treatment, and make them understand what to expect.
That's interesting. I like that idea.
Yeah, it's kind of. I think it's a good way to build community too, because now they're in a room with other people who are potentially confused as well.
Yeah, I tell you, in a previous life, I worked with doctors, and this one doctor who really had high use would mention the idea that when he first mentioned that we're going to do telehealth visits, he would do almost like a test visit always right there. He would say, okay, so watch, I'm going to send you this link. Let's connect.
Great.
See how easy that was? Because they don't want it to be the actual visit. So doing a quick test visit, and I imagine, I was just thinking off the top of my head here, the test visit, if you say you have an office staff, they could even schedule that in a sense, because they're not meeting with the PT. You can have your office staff just do that with them. That's
sure. Yeah, you could do that. Yeah, particularly if you have a marketing person or someone who's a good communicator. It's really about demonstrating that it's easy to do. It's easy to use. Also really important, though, is that patients and staff and doctors understand that telehealth physical therapy is an effective treatment. So we're not just reviewing home exercise programs today. We're going to do a full treatment. I'm going to assess you at the beginning. We're going to go through your plan of care and work towards your goals. At the end, I'm going to give you maybe more exercises to do, and we'll schedule something else after. But it really has to be a real treatment.
Right. They just give me the exercise program, but it's more than that. I love how you're telling them beforehand, this is what this is going to be like, so they know that it's more, because you want to address those concerns up front. If you just say, I'm going to schedule it, and then they say no, and you go, okay, it doesn't work.
Yeah, I mean, and I think a lot of patients sort of assume that it's going to be a check-in, and you can't really accomplish much on a telehealth visit. And we know, as practitioners, we know our value is not just the hands-on care. It's not just the machines. It's our knowledge. It's our problem solving. It's our compassion, which, right there, when you connect with a patient, that's part of what they come to you for. That's cool. You can do that through a telehealth visit. Yeah.
Perfect. So,
and a lot of PTs are recognizing that now. A lot of PTs, manual therapists, they never thought this was going to work, and they're like, wow, this is a lot different than I thought it was going to be.
Yeah.
It's kind of cool to see.
It's interesting. Every when I talk to a PT that's got like some of our larger ones, and they have more PTs, they're like, we're not going to do it. And then they start doing it. I didn't know it would be that easy. I didn't know. Yeah. I'm sold. I can see. Then they start to talk about how they can do it in the future, which we'll talk about in a minute. So Medicare. Let's talk about Medicare.
Sure. So as of last week, April 30th, Medicare issued a statement saying that physical therapists are eligible to provide telehealth services and get paid for them by Medicare. CMS put that through, which was, that was a huge step. We've been fighting for this in different ways for years, really. And since the COVID emergency started, it's really been, PTs have been slighted a little bit and sort of pushed to the back burner on the whole thing. In all fairness, there was a lot of red tape that CMS and Office of Management and Budget had to get through. And the APTA really pushed them hard in a very diplomatic way, of course, but they really worked hard for this and finally got it so that PTs, OTs, and speech therapists can provide services to Medicare.
Yeah, it's all therapists, right?
Yes.
It was the very end and the top of page 1 and 2 of the most recent CMS document that came out last Thursday or Friday, if anybody wants to look it up. It's all therapists. It was kind of, like you said, it was kind of, I don't want to call it an insult, but 3 or 4 weeks ago, and it was like, these codes are approved, but you're not approved.
Yeah, and I think that was, once again, in all fairness, I think that was a technicality.
Yeah.
Because of the the way things were written, they couldn't add PTs at the time as eligible providers. Regardless, we are now. And even better news is that everything is retroactive to March 1st, which was the beginning of the COVID emergency.
Interesting.
And it will last through the extent of the COVID emergency. At least.
So all the way back to March 1st, if you've done a visit. Yeah, we'll go into that in a second,
Sure.
I have a question I'm going to ask then that's not kind of prepared, but so what if I did like an e-visit? What if I did a visit using something like Healthy Roster and I haven't submitted it yet, but say it was 25 minutes, but I was going to calculate it as an e-visit? Because I haven't billed for it, can I now calculate it as
if it was a telehealth visit? Right. So, I've been saying for a couple of months that e-visits are not telehealth visits, and they're not. If it was a true e-visit, which essentially is a check-in where a patient poses a question or an issue to a practitioner takes their time to answer the question, guide the patient basically out of that problem, that's an e-visit. And, much like if a patient called you up or emailed you to say, my knee hurts from doing a lot of walking yesterday, and you take the time to respond to them, maybe send them some home exercises and guide them out of the problem. for years we've been doing that, and you get off the phone and you say, "Wow, I really should be able to charge for that time." That's what an e-visit is.
Yeah, that's a great.
So
Everybody always asks me an example, and I'm never good at giving an example. That's a great example.
Yeah, I mean, PTs, docs have been saying it for years. I should be able to charge for my time, much like a lawyer does, right?
Yeah,
and their patients are paying for our professional knowledge and opinion. So, if you were doing actual telehealth visits, which I was recommending to my clients because I was getting advice from the APTA that this was going to go through and it would probably be retroactive. They had said March 27th. So even better news back to March 1st. If you have claims, if you have visits from back to March 1st, you can submit them as telehealth claims.
So I just had a question that it relates to this. Is it only apply to private practice therapists?
Yes, that's as far as I know. I know that there's been a question about institutional. Not exactly my area of expertise, and I don't want to give a definitive answer, but
Okay.
Until recently, I was told that if you're billing on a UB04, you cannot bill for telehealth. And I may be wrong. If someone wants to send some information on that I don't know of, please do.
Okay. We'll look that up and probably have an answer by Wednesday at least. I'll make a note of that as well.
Okay.
So another thing is, when it comes to the reimbursement, how's the reimbursement compared to like an in-office visit?
It should be the same. So you're billing the same codes. There is no deduction for doing telehealth visits. You should be getting the same reimbursement. So billing for your time using Medicare billing rules, 8-minute rule for 2 units. That's 23 minutes of service. If you're doing 38 minutes of billable service, one-on-one with your patient, you can bill for three units, and you should be getting the same as if it was in office.
Okay, is it deal with the Medicare cap as well? How does it impact that?
Yes, it applies to all visits apply to the cap. So if you're reimbursed or the amount of reimbursement for the visit was $70, that $70 would apply to the cap.
Okay, so make sure I heard you right. So I'm billing the same codes. Do I need a modifier or the modifier in there?
Yeah. For telehealth, you need a 95 modifier in addition to the modifier that you would normally put on GP for physical therapy. If you're using a KX, still use your KX modifier if you go over the cap. But the additional modifier for telehealth Medicare claims is 95. And other payers are asking for a telehealth modifier as well. So, the big payers, the larger groups like Aetna, United Healthcare, Cigna, they all have different modifiers. It couldn't be universal across the board, of course.
Exactly.
But for the most part, they're using, and I'm just looking at my cheat sheet here, GT or a 95 modifier. That typically, historically, has been telehealth.
Yeah, we have a resource guide that we have on our website, but you also have a resource guide, right, that you give out for the year. Is that correct?
I do. Yeah, that's for my annual members. I have a resource guide including billing, best practice, private policy and procedure manual, and forms that are updated on a regular basis. And look,
these
things are going to change. These things are going to change a lot in the next year. So
and then I would be curious. United Healthcare, I want to say, and maybe Cigna said like it's to June 18th. But they don't know. I mean, I imagine that's going to change. What do you think about that?
Well, that would be me giving you my opinion. Because nobody knows. We don't know what's going to happen here.
Yeah.
But I would imagine at this point going forward, they probably will use some guidance from CMS, and CMS has said that these guidelines go through the COVID emergency. We don't know how long that's going to be. We just don't.
Yeah, and that's an interesting statement, COVID emergency. Like, when is that?
Yeah.
Talking about open-ended, right?
It is open-ended. And, hopefully there's some standardized guidelines to go by to determine the end of the COVID emergency, hopefully sooner rather than later.
So one of the things I think in the past, correct me if I'm wrong, but when I did it, if I want to do an e-visit, I couldn't do an e-visit with a new patient. I couldn't start the process there because
Correct.
it's an e-visit.
It
What
had to be an
about
existing
now
patient.
with telehealth? Can I do it
Yes,
with a new
you
patient?
can do evaluations of Medicare patients, and different payers have different rules on that. But Medicare patients, you could do an initial evaluation of a new patient.
That's interesting. So I imagine, just thinking out loud here,
Mhm.
want to make sure your website and like even your Google My Business and everything else is addressing the fact that you do telehealth visits, because without that, that patient there, that's probably, if they're comfortable with it, they're definitely looking for that.
Oh yeah, I mean, a lot of certainly my clients and a lot of other practices now have put a big button on their website saying we do telehealth visits, and yeah, I mean, it's an excellent resource to do intakes, and a lot of practices were using telehealth before COVID as a source of intakes, not necessarily a formal evaluation, but they would do a sort of a free consult with patients before an introduction to their practice, which I think is a great marketing tool.
So make sure I heard
Um,
that right. So you're saying they would offer telehealth and that was their way in or the first visit with people? Did I hear that right?
Yeah, essentially. I mean, for a lot of practices, they were using it not necessarily as a full assessment, but an introduction for the patient to the practice. Okay, so you have a conversation with a physical therapist who's going to guide you and say, what kind of symptoms are you having? And look, it's always a good idea to start off by making sure that the patient does not have a significant medical condition, clear red flags, and in an effort to essentially steer them to or away from physical therapy, meaning like if someone sounds like they have a kidney, they're having back pain, it sounds like they have a
Yeah.
kidney condition, they should be going to a doctor, and the PT practice is going to send them to a doctor. But if they have low back pain that's mechanical, caused by a particular incident, and the PT practice has direct access in their state and there's no other limitations, they can help them schedule an appointment at that point.
So yeah, so I got some more about the future. Before that, we had another question come in. I'll read it.
Sure.
You had mentioned that CMS will have these guidelines going through the end of COVID emergency. Has there any been mention about the like 1135 waivers and trying to push for telehealth past the COVID emergency timeline?
Not that I know. Well, I don't know how much success there has been, but the APTA is definitely working on that. They're doing everything they can to make the current regulations long term,
Yeah.
and that might involve attaching a bill to either a stimulus bill or a future bill. This is it's still in the big picture. It's still PT, and we're just a small PTOT speech together. Even we're still a very small portion of the Medicare and medical budget. So it's often hard to get the attention of lawmakers when we want or need something. That might be part of the reason why it took so long to get this far.
Yeah.
But there certainly are opportunities for things to go beyond the COVID emergency.
Yeah, I think no one wants to make the claim of knowing, right? It's just our opinion.
Yeah.
But on other webinars, I continue to say you can't put toothpaste back in the tube, right? I think it's been decades of nothing happening, and the fact that
Yep.
and look, like you said, to family practitioners, everyone is moving this way, and this is going to be the way. And now that people are doing it, they're comfortable with it.
Yeah. Not only comfortable with it, but really like they appreciate the accessibility and the convenience of it. And there's so many other reasons. I mean, look, technology has caught up to the needs of what we're trying to do in terms of connecting with patients. Technology is there now. Platforms like like Healthy Roster are built out now around broadband and better connection. So that definitely facilitates the situation, but also the fact that it has definitely become normalized in people's minds. Everyone knows what telehealth is now. So that was sort of the first barrier. What does it even mean? So now that's there. The patients are going to want it. Practitioners really appreciate it. And let's not be silly about this. I mean, insurance companies are going to look for ways to save money on the efficiencies associated with telehealth. And look, the healthcare system definitely needs efficiency. So if we can provide that, that even makes us more valuable. So I think telehealth has a big place in PT and healthcare in general.
Yep, I agree. We had another
And
question.
I'm advising.
It said, can PTs use an audio-only visit and charge like usual telehealth?
That's going to depend on your state, depend on your payer. I believe at this time Medicare does allow that. If it's a patient who has difficulty getting online or doesn't have the resources to get online for a video visit, yes, at this time during the COVID emergency, you can do that.
Okay.
With other payers, check with them, make sure the codes might be a little bit different.
That's one of the recommendations I think you make as well, and we make is when you're initially doing this and you're working with you should call beforehand the insurance company, the payer.
Definitely. If you're an in-network provider, I think most in-network providers already know this, to verify benefits with every patient before you provide services. And this is the same essentially because it's not a new service, but it's a new means of providing the service. So check with each payer, make sure that they cover telehealth in the same way that they cover in office, and they pay at the same rate that they pay in office. Those are two separate things. Be sure you're clear with your payer.
Great point, because it's two. Yeah, you want to make sure you know that. Did you ever have any payer come back to you and ask for records of how long the visit was?
No, but they are entitled to do that in terms of getting a log. Some payers, I've been told that some payers, particularly in the workers' comp space, they want to see video of visits, at least an occasional video. Not something I have seen firsthand. And I typically recommend providers do not record their sessions with their patients. I think there's potential liability issues associated with that.
Huge.
Yeah. So I typically advise against it. But logs certainly are a good resource to have. Just saying when the patient checked in, when the patient checked out, essentially, and you have it digitally.
Yeah, that was the experience I had in the past. Again, that you wanted those because randomly they would say we want to. It was like a random audit to say, do you have proof that this actually happened? And they didn't want video proof; they wanted some type of time-stamped proof, which we provide. And I've had people ask me about video, and I'm on the same belief as you. I even told people I think it's Vermont that even passed a law saying you cannot record a televisit visit because of the whole HIPAA compliance issue. It's like, and my analogy I give back to people is, if someone came into your office, are you going to record that and store that somewhere? You wouldn't do that, right? That's not good. So, are patients responsible for their own co-insurance for telehealth visits?
That, of course, once again, depends on the payer. A lot of payers have waived any co-insurance, co-payment, even deductibles. Check with your payer in your state. Medicare has said that the providers can continue to collect co-insurance. They can continue to bill the secondary payer. But if a patient is unable to pay that co-insurance or they don't have a secondary, you can waive it at this time, and they will not enforce that as part of COVID.
Very interesting. I mean, and you got to really know the payers that you're talking with, but that's part of that setup when you're talking to that person. We I got a couple other questions coming in, but I want to circle back. It's almost like when I first do a call with someone, you want to make sure they feel comfortable. You want to make sure that this is not just this is the value of the visit over just doing we're not going to watch a video together, right? This is the value of the visit. And then you want to know some of these details about their payer and everything so they can feel at ease. Are they going to pay for this? What is their situation? All those things really be up on that, because then you make them feel more comfortable. And that's huge. That's probably that right there explains, if you're not doing that, why certain people have issues with their patients saying, I don't know if I want to do this or not. Yeah.
I mean, the more clear you can be, the more transparent you can be with your patient. That's always helpful. You need to know what you're talking about before they come in, and you don't want your patients to get surprises. For sure.
Yep. So another two questions here, real quick. Not sure if you mentioned this, but the 95 modifier regular procedure codes for Medicare, or is there a specific procedure code you should use?
You can use if we're talking about physical therapy, you can use your usual physical therapy procedure codes. The only one that's off the board is your modalities, electric stim and ultrasound. If you're using them in the clinic, even if someone has a home TENS unit, you can't bill them for that.
Okay.
And manual therapy also off the board, 97140. But just about every other code is up there. Telehealth certainly lends itself to 3 or 4 codes: 97110 Therax, 97530 therapeutic activity, 97112 that's neuromuscular re-ed. You definitely can do some gait training as long as the environment is safe, or the patient has a caregiver that you trust as a practitioner. I said 97530. There's also 97535, which is education on self-care. I believe they even added the group code 97150 recently. And, some people laughed at that, but I think it's a great idea. I think you could be doing group sessions for telehealth. Why not? Particularly in certain settings.
So, yeah, because that's one thing we just added to our system about a few weeks ago. We added,
Oh, that's right. That's great.
We added a group, and we've got screen share. And so a lot of the things when we talked a few weeks ago, I said, what could we do to make this the best system? And you were like, this and this. And I went back to our developer and said, we need to do this and this. And he's like, done. And last Friday, he's like, all right, everything you've asked for is done. So all
you guys work fast.
Screen share, and then the group is great. So, and especially I've heard for occupational therapists, big for them.
Yeah, and a lot of practices do back pain classes, back schools, or they do whether you're billing for it through Medicare or not, like a Parkinson's support group or a chronic pain support group. Those are great tools, and telehealth is a great tool for that, particularly this time. Just like you do your Zoom happy hours, you could do Zoom back school. I think
that's a great idea.
We should definitely be doing those kind of things.
Yeah. So I want to answer some more questions. I'm going to let everybody ask their questions now, but as I pause, I want to give you a kind of a plug. Why don't you tell everybody where they can find you online and how you help?
Sure. Thank you, Michael. TelePT Solutions, that's teleptsolutions.com. I'm a consultant and a trainer for telehealth for physical therapy practices and other medical practices that are looking to start a telehealth practice. So I do an assessment of the practice. I will train the entire staff on how the telehealth portion is going to work and how it's going to integrate with what you do now. And I'll guide you through the whole process. I have documentation of everything. So forms, policy and procedure manual. And look, I'm the clients that I've picked up in the past few months have all had the idea that they're going to be doing telehealth for the long run. I've said to them, and I stand by this, that a year from now, physical therapy practices will need to be 20% remote. You're going to need to have this component of your practice. There's going to be people who are not comfortable coming into your practice. There's going to be people who appreciate the accessibility. And there's always going to be times when people have to cancel or they can't get to you, and to give them the option of telehealth or a remote visit is tremendous for them. So it should be part of what you're planning now, and a year from now, you should be at about 20% of remote. 20% of your practice should be remote.
You told me that a few weeks ago, and then I had some calls with some current customers, some medium-sized, some very large, some of the largest in the country. And I got the feedback of their operations people said, where do you see this going in the fall, in the future? And it was interesting. Every one of them, 20-25%. Talked about, if I do 3 visits a day, can I take one of those visits and it becomes telehealth? The mom, the stay-at-home mom who now can't make it because the kid's sick, or everybody's working from home now, right? There's difficulty there.
Yeah.
And then you have the fact that you got somebody that is an active business person that maybe is difficulty for them to get out 3 times. So they kept on giving all these use cases where it just made sense. And you've given about 4 or 5 more here today, above and beyond what we heard.
And practitioners like it too. It's a change of scenery, a change of pace for them. It definitely, telehealth is one thing that can really help with provider burnout. And we all know, there are plenty of PTs that it's a problem in our profession, that people do burn out from the grind and the physical aspects of in-person care. To be able to mix it up a little bit for a practitioner can really extend their career.
I love it. All right, couple more questions coming in. The next one is, you said Medicare will cover, I'll just read it. So you said that Medicare will cover 3 units. Is that just one time a week?
Nope. This is you can schedule and plan, and I didn't say Medicare would necessarily just cover 3 units. If you're doing a 58-minute session with a patient, bill for what you're treating, for the time that you're treating. This is one-on-one patient care, and it's the same as if the patient comes into your office. How much time you're spending with the patient? What are you doing with them? You should be billing for that time. There's no limit per visit. There's no limit to the number of visits you can do per week. You do have to abide by the cap and whatever other restrictions that Medicare has in place. But if there's medical necessity, you should be scheduling your patient. And there's also, I was asked the question on another panel discussion, if you could see a patient in the office and also do telehealth visits with them. And the answer is absolutely. There's no limitation on that. We typically call that a hybrid model, where a patient the best example is after a total knee replacement, patient you want to see them 3 times a week, but they can only get transportation to you twice a week. So for that third visit, they can do a telehealth visit, and you can get a lot done in that one visit. And maybe they do 2 telehealth visits a week and come into the office one time, particularly at this time when things are a little more challenging.
Yeah, I tell you, we can only take a few more questions. We'll have to do more Wednesday. We wanted this to be 20 minutes. As you could tell, we got a lot coming in, and we were already at 40. Tell you, we've hit on something. I got one more here. What should we ask our insurance liability provider to ensure we're covered to do a telehealth visit?
I think the question answered the question. Ask them if they cover telehealth visits. Ask them if you as a provider, or all of your providers, are covered to provide visits remotely. Tell them you're using a HIPAA compliant platform. That's definitely relevant. You should be on a secure network. They might want to know that. Any other considerations on that? That's pretty much. I mean, look, I haven't heard of any liability providers or insurers charging more or limiting visits because of telehealth, or limiting liability coverage for telehealth. The other consideration, and if you want to be really thorough, ask if there's any considerations about a practitioner practicing from their home, meaning not in the office. So if they're on their own network, their own home computer, or even a company computer from home, if that makes a difference in the liability. And it should not, but you obviously want to make sure
cover all your bases. Yep.
Cover all your bases. Yep.
Well, I'll tell you, if you're watching this on Facebook, we got people on Facebook. We'll do it again on Wednesday. If you looked, everybody that's in Facebook groups, if you're watching this, you can make it a watch party. Come for Wednesday as well. Make it a watch party. It shares it out to everyone that you know. We're looking to help as many people as possible and get the word out. So, anything else, Daniel?
Almost muted myself. No, I don't have anything. I think most importantly, as you get into telehealth, it's really easy to start. It's really easy to do a couple of visits, and look, people are doing it on FaceTime. People are doing it on their free Zoom accounts and whatever else. Telehealth should be a part of your practice. It's going to be 20% of your practice if you are going to succeed in the year to come. So I think it is important to do it right. It's important to plan a strategy, how it's going to work. It's important to be compliant and have your policies and procedures in place, and look at it as a long-term portion of your practice. And it's going to be something that's going to help you grow.
Appreciate it. So thank you. We'll be back Wednesday. Also tomorrow, anyone on, if you want to join us, we'll be doing just a straight demo of our product and how we make it easy from start to finish with our digital telehealth consent, the one click in, the sharing, all the features, everything we talked about today, we do. And again, we're free until July 1st so you don't have to worry about that during this time. I will see you again Wednesday, and thank you to everyone that joined us, and thank you, Daniel.
Thank you for having me on, Michael.
Have a good one.
You too.